This is another tricky case because this is a woman who had liposuction of her legs and ankles about 18 months previously and still wanted some additional improvement on her ankles. So this is ankle liposuction. You see we're beginning with an inferior incision moving superiorly. The skin is thick, and you can see the marks from the planning where we're going in various channels. And Gerhard, why don't you take over at this point?
Yes. Well, patients who have lost their ankles, what I want to say is they don't show. They have a particular problem and they want to have them as slim as possible. So it is sensible not to do it in one go and let a condition heal and do a redo after a certain amount of time, like after a year. And this can also be done even if you would be afraid of doing any kind of lymph vessel damage. We never had any condition like that using the tumescent local anesthesia technique. And plus, with the help of the vibrating device, you can see we use, with no big movement, we just use the cannula like a rubber. And we can erase fat anterior or posterior to the malleolus and form a nice ankle region. So with the particular shoes, it can be a very beautiful area of a female.
And notice over and over again in these cases that these tunnels are made in the long axis of the leg in order to avoid damage to the structures. It's just a key element here.
The strokes are done without any kind of force. It's like a massage of the tissue. And what you harvest in total maybe 200 to 300 cc's, but tremendous for that little area. Also, you see we below now the ankle, forming the rest of this whole region and giving that a normal anatomical shape.
How long does it take a leg or an ankle to contract down?
It all takes a lot of time and nothing comes easy, but you're rewarded if you invest it, and I would estimate probably 30 minutes for one leg, for one ankle.
Do you have the patients wear compression stockings postoperatively, and if so, for how long?
My advice is 4 weeks, at least, sometimes even longer. It is different to any kind of other compression technique in liposuction surgery with tumescent local anesthesia. For saddlebag or abdominal liposuction, I think 1 to 2 weeks is pretty good, and the patient can decide if he wants to wear it longer. In the calf and in the ankle liposuction cases, I really think 4 to 6 weeks is minimum.
We might just talk about the postoperative low-dose heparin at this point, since we've got a little break. And this seems to be the standard of care in Germany and Europe in order to avoid deep venous thrombosis, whereas in the United States, I'm not sure I know of any liposuction surgeons that give low-dose heparin postoperatively.
Yeah. Well, it's a forensic point, number one. Number two, even in rare cases of deep vein thrombosis, the risk by doing any kind of surgery, also tumescent local anesthesia liposuction, is always present. And since with any injury we activate our coagulation system, and with that also the threat of a deep vein thrombosis is present. It doesn't increase the risk by working on an ankle, because most of the times the deep vein thrombosis is located in the lower calf. It'll occur on the 5th, 6th, or 7th or 8th day post-op. It will not be immediately during the liposuction surgery, like in other big abdominal plastic surgeries where you have sad events. So we have to be aware that we are in touch with our patients for a long time and speak with them about it. So in case it happened to them, they are in contact and we can hand on a treatment so they are safe.
So, bottom line, low-dose postoperative heparin is really, there's a difference in the standard of care between the United States and Europe.
And as we can see, and we have to see it, it doesn't hurt the patient, it adds to the safety and the security